As a nation, we have always wanted to treat behavioral health as something that kind of happens over there and it happens to other people. Do we see behavioral health patients in our communities as deserving of the same care as everyone else? At Oceans, we believe that mental illness is not a stigma. It's not something to be carried as a burden. It's simply a medical illness in many ways, no different than the diabetes, the obesity, the heart disease that many struggle with.
What we do is very important. Many times our patients have been abandoned by their families, and we're their last hope. We're it. We are the safety net. My goal every day is to protect every one of our patients, protect their rights, to make sure they're getting the best care in the least restrictive setting possible. Every single one of them is important, and the rights of every patient and their improvement is important to us.
We've all experienced depression. I think we've all experienced anxiety. We've all experienced what it means to lose a job or what it means to lose a loved one. Oceans brings hope to those who don't have it in communities that have no resources.
So often, psychiatric hospitals were large facilities in metropolitan areas, and people in Middle America did not have access to really specialized behavioral health resources. We like to grow where we're needed, and one of the unique things about Oceans and the way that we've organized our support services, we can go into smaller markets that larger competitors can't, and we can bring the resources to the people and help care for them where they live, with their families and in their local communities.
The organizational structure that we've chosen at Oceans, we have a support center, which is what most folks call corporate offices, to support our hospitals in the provision of care. And so that enables our clinicians and leaders at our hospitals to really simply focus on the patients.
I really appreciate what Oceans does, not to worry about the administrative burden. As a physician, I've been working for so many years, I never deal with finances. My goal is to, as soon as I go to the hospital, my goal is a patient. I know patient care. That's what we always focus on.
And so what we found from that is increased levels of quality.
Having our roots in geriatric care, we became very good at treating older adults who often have medical complexities. So from there, we really understood that we need to treat your psychiatric condition, but we also need to treat your medical condition.
Ocean's clinical model is based on its 6 core convictions. We look at the patient as an individual and take into account the biopsychosocial model. So we have very extensive treatment teams where we go over everything from their medical problems to their psychological stressors to their actual biological history of depression and what we're doing to treat that. We invite families into our treatment team and include them in the treatment of the patient. And so that's very different than most psychiatric hospitals.
I think for me, especially as we're building these buildings, every standard we have, every vendor we use, it's all about that patient experience and making sure, especially in behavioral health, you have to make it as safe as possible. Everything we do is about the patient.
We're starting to have a real conversation about mental health in this country. Partners are coming to us looking for Oceans as a potential source for their behavioral health needs. And you can see it now happening for us all over the country. Oceans is at a nexus of need and capability. We have all the capability to deliver great services in the behavioral health space, and the need couldn't be greater.